Hello, everybody. Thank you guys for attending my presentation today. I'm going to be talking about the evaluation of the oral health screening component of Score 1 for Health. I'm your presenter, student Dr. Brian Pholvichitr, and the collaborators for this presentation was Doctors Sharon Gordon and Latasha Vick, as well as the Score 1 for Health staff who allowed us to kind of attend these events and be able to learn more from both the medical and the dental sides. So let's talk a little bit about what Score One for Health is, in case you aren't familiar with it. So Score One for Health is a KCU started program, which started in 1992 up in Kansas City. And this program was meant to help elementary age children in the KC area get free health screenings and free health education. With the opening of the medical school in Joplin as well, this also spread to Joplin. So now it both takes place in both the Joplin campus as well as the KC campus. And in these screenings, we provide physical, visual, auditory, and oral screenings. And that's something that's really important is the oral screenings because a lot of MD and DO schools don't give a lot of time and hour to teaching medical students about the oral cavity and things like that. So I'm really glad that we have this Score One for Health program here at KC because we're allowed to help facilitate learning between medical and dental now. With that, we have the brand new dental school, which I'm so glad to be a part of. It opened in 2023 here in Joplin, Missouri. And we had our first official class in 2023, and now we have our second class that came in recently as well. So let's talk about the why. In the United States, caries, or also known as tooth decay, is the most common chronic disease of childhood. And as you can see in the picture to the right, this is something that a lot of children we see in this area, especially in the clinic and when we're out on health screenings, we see children who have kind of teeth like this. And this is something that we really want to address because it is a big problem and it affects the students' self-esteem. If they're in pain, it can affect their school life because they don't feel like going to school or they need to miss school because they need to see the doctor or the dentist and things like that. And this issue is especially prevalent in Missouri, which has a 5 to 15% higher than the national average, which is 50.5% for decay found in children aged 6 to 11 years old. So the national average is already quite high. And the fact that Missouri is even higher than that national average shows that there's a great need of help that's needed here in Missouri and also in Joplin. And Score One for Health is a brilliant program that allows interprofessional collaborations between both the dental and medical students. I was recently allowed to be a part of Score One for Health, and I got to work with some of the medical students here on the Joplin campus. And I saw some of my dental colleagues as well being able to participate. And I saw a lot of learning in which the dental students were able to point out certain restorations and cavities and things like that to the medical students, while the medical students were also able to show dental students how to kind of perform auditory exams and physical exams and things like that. So this is a great way to kind of bridge that gap that's kind of formed recently between medical and dental to show that there is a need for interprofessional collaborations between these two fields to allow us to really reach the pediatric population and ensure their health is in a better state. So with this research, it consisted of a two-part study, the first being an oral health assessment performed by KCU dental faculty using the Missouri Preventative Service Program, also known as the PSP form, in which they used it when they went out to local Joplin elementary schools. After all that data was collected, we did an analysis of the data from these assessments and then just did an overall view and understanding to see if there's any trends and kind of create that baseline of data that we have, especially with the opening of the brand new dental school. We wanted to kind of understand how the pediatric population looks now, and then we're going to check again in this longitudinal study in which we can see if there's been an improvement with the brand new dental school and dental students coming in and really helping out the community in which KCU has its mission statement for. So as we continue with the methods, this was a cross-sectional study which was performed amongst elementary school students by medical students and dental faculty from Kansas City University. The survey results were given to a school nurse to contact parents to refer to a dentist if in the area if urgent treatment was found. And urgent treatment was found is like if they had an abscess or swelling around their teeth in which there was a lot of pain, that would be considered urgent treatment. And the school nurses would be notified immediately, so then they could notify the child's parents and find a local dentist that would be able to help alleviate the pain for these children. In total, 1,716 elementary students from 8 different schools around the Joplin area were given these oral health screenings, and that was performed by 431 KCU medical students and dental faculty. The surveys were conducted using the Missouri PSP form completed by the dental faculty. And before they even went out onto to these different schools, the med students were given a little brief about how to handle the PSP form, as well as reading and looking into a child's oral cavity. And they were taught this using this Smiles for Life curriculum. And in this curriculum, it's a physician created curriculum made for other physicians. So it wasn't using a lot of lingo and things like that that maybe medical students and medical faculty weren't too aware of. But this kind of just helps create a better understanding of what the oral cavity has and what to notice and things like that, to just give it a better overall understanding of everything together. And this is the form that the dental faculty would use if they were called over by the medical students. So how it kind of worked was, if the medical students had any questions at all about what they were seeing in a certain child's mouth, or they were confused, or they had questions about anything related to it, or just really didn't really know what they were looking at, they would be able to call over a dental faculty, and the dental faculty would come over with this form, and they would fill this form out, as well as helping the medical students in understanding what they saw. So if we look carefully, the first question they ask is about the gender. The first question asked is gender, so male or female. Then the second would be race. Third was the ages. Fourth, grade. Fifth was the oral hygiene, which is non-satisfactory or satisfactory. So not satisfactory being if the child had moderate to heavy plaque, or satisfactory, which is little to no plaque and the tissues of the gums looked firm. Presence of dental sealants. So these are just kind of preventative measures in which we put into the back of the posterior teeth, and we kind of use it to kind of protect those areas from getting cavities, because that's where they tend to form, because there are a lot deep pits down there, so food tends to get trapped. And what I noticed when I went on to my Square One for Health rotations was that this was oftentimes the hardest thing for medical students to notice, was to see if the child had dental sealants or not, because oftentimes they blend in with the tooth quite well. So if you're not used to seeing what sealants are, or if you've never seen them before, it's really hard to tell if they have them or not. The seventh question was the history of rip and decay. So that includes if the child had any decay currently, if they had restorations, and if they were missing teeth on at least 7 or more of them. 8 would be treated decay. So that's just any restorations or any missing teeth due to decay. There's untreated decay, which must be just obvious decay that you see that hasn't been taken care of, or it's a broken or chipped tooth in which the untreated decay was present. And usually around this age, since we are looking at elementary age children, they would either have none, they would have primary only, which is just the baby teeth, primary and permanent, so that's a little bit of mix. Some teeth are still babies, some teeth are adults, or they were permanent teeth only, in which only the adult teeth that had came in had decay or restoration, things like that. And lastly would be the treatment urgency. And the treatment urgency falls into 3 categories, which is no obvious problem. So the child was quite healthy. They didn't have anything that really needed to be looked at. There's early dental care, which is cavitated lesions or treatment that wasn't need attention immediately, but you could wait several weeks before receiving any attention or care for that. And lastly, and what we really find important, is urgent care. So that's anything with pain, infection, swelling, or treatment within the next 24 to 48 hours. And that's something we really don't want to see amongst children, because that means that this is a very serious case, and we want to be able to take care and help alleviate the pain for these children by making sure that we get them to their school nurses so they can inform their parents and help find a local dentist that can take care of this issue for them. So after analyzing all the data we collected from the PSP forms, out of the 1,700 students that were screened in total during this year, 509 students were screened by just dental faculty alone. And if we look at the chart here, we have the gender, the age, and the school in which these screenings were performed. And the biggest thing that caught my eye after I looked at all this was that Dover Elementary School had 162 students that were screened by the dental faculty. However, schools like Soaring Heights only had 5. So there was a really large discrepancy in how many students were being screened from these schools. So that really asked a lot of questions in which, why is this happening? Is it that maybe Dover had a lot more issues with oral health while Soaring didn't, or what was the cause of that? Along with that, we see from the male to female ratio, there was quite a bit more female respondents than male respondents to these surveys. So this brings up another thing: is there a correlation between the male and female regarding their oral health, especially in this area? So this helps us to really understand and create a baseline. However, one thing we want to take note of is that this is only 509. So it's about a third of all the students that were screened in total. So we don't want to really extrapolate the data into anything more, but we want to just have an understanding of what it's looking like and being able to kind of create that baseline to figure out, okay, this is how the oral health is in the area, and we want to be able to improve it in the future. As well, we have the ages of the children, 0 to 5. Most of them were in between the ages 6 to 7 and 8 to 9, while you have a little bit in the 10 to 11 range, as well as the 0 to 5. And all of these students, like I said, were from Joplin Elementary School students. I know KCU has a Kansas City campus, and they also perform Score One for Health, but all the data we have for this research comes from Joplin alone. So looking at the results, we see the first one here on the left, which is the distribution of schools. And Dover was quite large. It was the largest school population out of all of them combined, with at 31.83% of the children came from Dover, while Soaring Height, like I mentioned before, was less than 1%. And then you have other schools who also had quite a bit, like Stapleton was the second most at 23.18, and Royal Heights at 5.5. So there was really quite an uneven distribution of students who were screened by dental faculty. And this could have a multitude of different factors regarding maybe the medical students didn't really need assistance for a lot of these students, or that there weren't enough dental faculty at certain schools to kind of cover when they needed to be and things like that. So there's just many things that we don't have full control of, but this kind of gets us a good understanding of, how many students are coming from each school in the local area. The second figure is about the location of untreated decay by the school. And untreated decay is something that we really want to look at, because untreated decay is something we don't want the children to have. So if we look at each school, we see that Dover, which has the most amount of students, also had probably the most amount of decay on red, which is the permanent teeth, orange, which is primary and permanent, yellow being primary only, and green being none. So there's quite a bit of green on each at each school, which is a good number we want to look at. But with that, we also do still see quite a bit of yellow, orange, and red from each school. So we want to be able to address that issue, because it's not like these children are out there and they're in, good oral hygiene. There's still decay that's out there that still needs to be treated. Even if it's not immediate or urgent care that's needed, it's still something that we want to be able to address and provide care for in the future. As we continue on, we have our third figure here, which is the history of rampant decay. And I talked about it a little bit before in the PSP form, but history of rampant decay is whether a child has cavities, a restoration, or, missing or broken teeth due to decay on 7 or more teeth. So we see each school here laid out, green being no, they have no history, and red being yes. And if you look at it, basically almost all the schools had children with history of rampant decays. And this is something that needs to be addressed, because that means that these children had 7 or more teeth that had restorations or even decay on them. So that's something that we really need to address. And that just shows and gives us an idea of where we are in the community with oral health regarding the children. And there's still a great need for care that's needed for these children, so we can minimize this number. And then finally, the last figure is the dental students by school. And I talked about that a little bit before, but dental sealants are a great way in which we just apply a little kind of like covering. We just paint a covering on the posterior teeth, so your molars on both the uppers and lowers. And this kind of allows food, prevents food from being trapped in these areas in which they can kind of build up and accumulate. And then that plaque turns into calculus and it can create cavities and things like that. So by placing these dental sealants, it's preventative. And we want to try to prevent rather than just go in and restore these teeth. Because if we can, prevention is the key, because we don't want to kind of put these kids under, local anesthesia, or sometimes they don't cooperate and they might need sedation and things like that. But being able to just put this dental sealants has shown to be a great way to kind of prevent caries from occurring in these children. So we look at the three graphs here. We have missing, no sealants, and sealants. And quite a bit of students do have sealants, but just as many students also do not have any sealants. So we really want to get out there into the community and be able to kind of get more sealants onto, because this is a great way to prevent caries from occurring in these children, like I said. And if we can see the number of sealants increase, then I think we'll see a greater and see a decrease of untreated decay and treated decay in general, because these dental sealants are a great way to kind of prevent it from occurring. So in summary, 1,700 students received the screening for the 2022 to 2023 year in Joplin. Out of that 1,700, about 509 students were screened by the dental faculty. The median age of the students screened by the dental faculty were 9 years old, and the ages range from 3 to 11. Almost all the schools had a greater number of female than male participants. So that's something that's really interesting that I noticed. So it's like, what's the reasoning between female participation being higher than male participation? Is it that maybe the male participants didn't want to be a part of Score One for Health? Or was it that their parents didn't want them to be a part of? Or was it actually just maybe females tend to get more caries than males, especially in the pediatric population? There's a whole multitude of variables that can come into a play, but it really gets the wheel spinning to try to understand why that is. Out of the data, 13.6% of the students had a history of rampant decay. So that means 13.6 of the entire students had 7 or more restorations, decay, broken teeth, anything due to decay in their mouth, as well as 21.2% needed to have early or urgent dental care. So if it's early or urgent dental care, we really want to be able to introduce them to a dentist to be able to take care of the needs that they have and to provide treatment where it's necessary. I talked a little bit about the limitations, but one of the limitations was that the only data collected by the dental faculty was included in this evaluation. So I discussed how about 1,700 students were screened in total, but only 509 were screened by dental faculty itself. And that just shows only a third of all the children in the Joplin schools that were screened was taken into account into this study. So if we were able to kind of get more screenings and more data from those screenings, I think we would have a lot more information that we can kind of take from it, because it's just, instead of having just a small sample, we'd have a much larger sample. And with that, we also have dental faculty, they're trained and they're used to seeing kind of all these decay and restorations and sealants in these children's mouths. So it's able for them to be a little bit more accurate than, say, medical students who aren't fully, exposed to seeing these things on a day-to-day basis. So they might not understand or fully be able to identify what they're looking at. Along with that, we have the school representation, which I find is a huge thing. Like I said, Soaring Heights only had 5, while Dover had over 150. So that was a really large range of representation of students from different schools. So if we were able to kind of get more of that data from this one school and more of the data from the other school to where it was closer in numbers, I think that would give us a better understanding and a better representation of how it is within the oral health between this, because a lot of things can go into a play. Maybe certain schools have different socioeconomic factors, certain schools on, different areas, more affluential areas. There's lots of different factors that come into play that we really need to look at as a whole, rather than just looking at what we have collected, but the data shows. So in conclusion, there is a great need for urgent care and treatment of decay that still remains here in Joplin. And with the opening of the brand new dental school, there's a greater ability to reach more children for their oral health needs. And with that, we expect to see a decrease in untreated decay and an increase in sealants in the four-state area with the opening of the College of Dental Medicine's Oral Health Center. So with the opening of the Oral Health Center, these children will soon be able to kind of come in, get the care and treatment that they need, and more dental students are able to go on these Square One for Health rotations and things and participate in programs like that, in which they can go out into the community, provide these screenings, provide education, includes brushing, flossing, just learning more about the oral cavity, so we can kind of inform and educate the children more, so they're more aware of taking care of their teeth, because you only get one set of teeth. You get your baby and your adults, and you really want to maintain what you have, because nothing beats your natural teeth. So if we're able to kind of educate children, I think that will be more beneficial for them in the long term. And when they become adults, they'll have a better understanding of why they need to brush their teeth, the importance of brushing their teeth, the importance of seeing a dentist, 2 times a year, getting hygiene checks and things like that. So with that, we really do expect to see a decrease in the untreated decay and an increase in sealants within, the four-state area, especially in Joplin itself. These were my references I used, the CDC, as well as the burden report from the Missouri Department of Health and Senior Services. And if anybody has any questions.